Well, congratulations to all of you for being here tonight. And I'm just here to talk a little bit about your newborn and answer any questions you might have. So if you think of any questions anytime throughout the talk, feel free to interrupt me if you'd like to, and we can also answer questions at the end. I can stay as long as you need, relatively speaking, I guess. So let's start out by just talking about just how important this is. I mean, I don't know if this is first baby or fifth baby for many of you, but they're all kind of important. I have 3, so I have a little practical experience to talk about also. So one of the questions is, can you ever really be ready? It'll happen regardless, but there's a few things you can do to try to be ready. Obviously, there's baby classes offered at the hospital where you'll be delivering, and I do encourage you to take those classes to learn about breastfeeding issues that you might have. Also just about the whole labor and delivery process. Many of you have had these discussions with your doctors who are delivering the baby already, but I think that's a really good thing to take advantage of. They do have tours offered in many of the hospitals also, and one of the questions is, do they have a neonatal intensive care unit at NICU? Hopefully that'd be something you would never have to see the inside of. It's a special place where babies with special medical needs can go to right after birth, or even several hours after birth if they need to. But it's just kind of comforting to know if that's present, and all the special doctors, equipment, special trained nurses available to help you if you think you might need that. I think it'd be a good idea to just be aware of that ahead of time, even though you're not likely to need it. Also, as far as picking your doctor for your baby, certainly you can have a prenatal visit with most doctors offer that. I know that all the physicians and children's physicians in my organization do that, where you can meet different times of the day. Usually it's the end of the day, but some people prefer to meet early in the morning or over the lunch hour. And just to come to the office and spend maybe, I don't know, anywhere from a few minutes to half an hour or longer, just talking to the doctor to see if you think that you're able to converse with him or her and answers your questions. The office looks nice, seems clean, safe, parking is good, etc. All the practical things that will come in handy for you down the road. Also just the location. Offices are located throughout the city. It's nice to have something convenient to your home, your work, your child's daycare place eventually, whatever it might be needed for convenience. Hours, many doctors' offices now, as in our group, offer either early morning hours or they offer late extended evening hours as well as weekend hours. So it's nice to just be aware of those choices you might have as you pick a physician. And also making sure they're on your insurance plan. That's kind of a basic, but most offices do participate with all insurances, but not all of them, so it's good to know that. Also, board certification, we all go through a certain amount of training after just the 4 years or so of general medical school. Pediatricians go through usually at least 3 years of special training in just pediatrics and then have to pass all these written and oral exams. It used to be oral exams, now it's mostly written exams to prove your certification status, that you've mastered the minimum amount that you need to know. And then as far as preparing for the baby herself, himself, a couple things about the baby's room. One is the crib itself. Studies have shown that babies have a much greater safety by staying in a mattress that's very firm and not soft and cushy. And also there should be no real bumper pads. Those are kind of misnamed. They're mainly just, I guess, cute pads to look at, but they really don't prevent the baby from bumping her head up against the crib as she gets older, starts rolling around. Actually, they're a risk factor for sudden infant death if the baby gets her face up against the bumper pad or getting an arm or leg stuck down underneath it between the rails. So we don't recommend bumper pads of any kind anymore. A bassinet is a convenient thing to have if you're going to be keeping the baby in the room with you initially. You don't have to. Babies don't have to be in room next to parents. They can be in their own bedroom right from the first night home. But certainly it's convenient to have them in the bedroom at times. We just don't recommend the baby be in the bed with you, with the parents. That's called co-sleeping, and that's been shown to be kind of dangerous. There have been some babies who have been badly hurt when parents roll on top of the babies or try to nudge the baby out of the bed. So next to the bed and in the baby's own crib or a bassinet would be great, but not in the bed with you if at all possible. Especially breastfeeding moms find it so convenient just to have the baby snuggled up there. Everybody sleeps better, but it's just a little bit risky for the baby, so we don't recommend that. As far as baby monitors then, those are really not necessary. It's sometimes very reassuring to have the monitor if the baby's not in the bedroom with you. But it's not a necessity. We don't highly recommend it. We think it's fine if you want to do that, but certainly not a necessity in any way. As far as car seats and strollers, those are pretty crucial. The car seat in particular, it's state law now that babies have to be in an approved car seat to leave the hospital. And so they'll want you to bring your car seat up into the room in the hospital to prove that you have that available to take the baby home in. So it's nice to have that. And also know how to install it. They're a lot more technical now than when my 3 kids were little. We just had the little seat that just put down and you put the seatbelt over it. But now there's platforms and all kinds of different things. So checking it out ahead of time, making sure you find one that's easy to install is kind of helpful. There are places that can help you do that. There's some Safety Council of the Midlands places where you can take your car with the baby car seat and just say, can you make sure we're installing this correctly, and they'll help you do that. So, but making sure you have the car seat available when the baby goes home. And the stroller, I don't know, if your baby's due soon, we may not have too much strolling time left around here, but stroller is nice to have at some point. The bouncy seat, not a necessity again, but it's kind of nice to have something like that handy for the baby. Some babies just need that little bit of extra stimulation to settle down, and it can be auditory stimulation like quiet sounds or keeping a radio turned on low in the background, but certainly the stimulation of the bouncy seat gives the baby some movement. That can be helpful. They even make the seats that have like little vibration motors on them that kind of stimulate the vibration also, and some of that just kind of mimics the vibration your baby is feeling right now inside the womb. The baby senses the heartbeat of mom, the breathing of mom, and those kind of vibrations and sensations. So sometimes those types of devices help the baby be much more comfortable and less fussy and easily irritated. We think those things are fine. Again, not a necessity. Your baby may need none of those things, but kind of nice to have that as an option perhaps. Feeding supplies, well, an important thing is, of course, having a plan for feeding. Breastfeeding is great. We recommend that everybody consider breastfeeding, but breastfeeding doesn't work for everybody. My 3 kids, none of them were breastfed for a variety of reasons, and I don't think that's a problem at all. I support breastfeeding, yes, but we also support any kind of feeding that works for you and your family and your baby, whether you want to give breast milk in a bottle or formula in a bottle, or just breastfeed from the breast. Whatever works for your family, that's important. There is no only one way to do it. You'll find out, if you haven't already, everybody's an expert, but nobody really knows your baby yet because that baby isn't here yet. So you'll have to do whatever works best for you and for your whole family. As far as equipment, there's a concern a little bit about a product called BPA. It's a product that might be found in some nipples, some bottles, some pacifiers, and that has been shown to be a slight risk for increasing cancer risk in the baby. So if you can find a product that doesn't have that, specifically says no BPA in that product, that would be recommended by us. Again, it's like many things though. We don't know how big a risk it is, but why take any unnecessary chances if there's an option that's available? As far as breast pump, if you're going to breastfeed, it's nice to have a breast pump, and you'll get in the hospital when you're there, they have lactation consultants usually, or just the nurses too, to help you with training on some of that. But getting a lot of practice from those people is just crucially important. When you go home, it's kind of hard to like watch a videotape or read a book or talk to somebody over the phone versus if you're in the hospital and someone can show you how to pinch the breast or flip the baby around or whatever it might be to make breastfeeding more successful, make sure the baby can latch on and things. But using the breast pump is also helpful if you get that training in the hospital about how to use the breast pump, when and why to use the breast pump. And there's different options. There's manual pumps, which are of course less expensive, and literally one breast at a time, you're just kind of pumping to stimulate the production and letdown of breast milk. There are also electric breast pumps, which are much more effective and convenient, especially the double ones where you put one on each breast and you're pumping at the same time. That's more efficient for your time. You'll find your time is really all of a sudden short if you haven't known that already. And so it's nice to have that option. But again, breast pumping is something you're not required to do by any means. And if you breastfeed, many people never use a breast pump and breastfeed successfully. It's just another option to know that you have available. And once you get in the hospital and you start talking to people there, they'll give you some ideas about that. Breast pumping is also good just to stimulate initially getting your breast milk to come in, which is sometimes a slower process, especially for your first baby. So getting all the help you can to get started would be a good thing in the hospital there. And I guess it's kind of interesting, the last line, remember the most expensive things are not always the best. That's so, so true. And I know it's probably not the best example, but when our kids are little, I wanted to buy a car seat. I didn't know where to buy one. So I went to Consumer Reports magazine in the library and I just looked up car seats, and there were like 50 of them. And of course, the top 3 or 4 obviously were not the most expensive. And the one I bought lasted for my son, my 2 daughters, and then lasted for all these nieces and nephews who just passed it throughout the family. The thing was indestructible, and it was not the most expensive one. So I just think it's good to try to have some resource you can ask your doctor, family, friends, but an objective thing. I'm not promoting Consumer Reports magazine, but it was pretty objective and gave good information about that. I still think they do review car seats and different kinds of childhood supplies like that, monitors and things like that. Clothes for mom and dad? Well, obviously for moms, having a good supportive nursing bra and PJs that are convenient to get in and out of, that are warm enough but not too hot, and have enough openings and large enough openings to access things you need to access is important. I'm not so sure about PJs for dad there, why the dad's clothes are listed on this slide. I think dads have it pretty easy when it comes to this kind of thing, but just kind of planning that you'll need a little bit more room and flexibility in the clothing, and the time of year your babies do makes a difference there too. So as far as the baby's going home outfit, well, they just have to be cute, really, I guess. I mean, and they all are. I mean, no matter what the outfit's like, the baby makes the outfit, you know, so it'll be cute for sure. But picking one that's comfortable and loose enough and that type of thing, and the babies are usually small enough, that's not a problem. But getting the pictures in the hospital, they always want, you know, to offer you to get the pictures in the hospital. They want your baby to be in the cute outfit you want. So it's just nice to prepare all that ahead of time. You know, a good idea is just to sit down at home and start making a little list and have it handy somewhere, either on your phone if you're that person, or on a piece of paper if you're more like me. And just have that handy so you won't forget things you want to get in a hurry at the last minute, which it seems like always is the case. As far as nursing pillows, the boppy pillows, those type of circular pillows that moms can use to help support her and support the baby as you breastfeed. Again, those are handy to have, and if you take any lactation classes ahead of time, they'll go over that kind of thing with you in detail. Again, it's not so convenient to move the pillow around as you move around the house, but if you want to have like one particular location and you're always feeding the baby in that chair, or when you're on that couch or whatever, it's sometimes convenient to have something like that to help support. As far as other items to have, it seems like a lot of cell phones have the camera built in anymore, but having a camera in the hospital for your own pictures, laptops to send pictures or send emails to family and friends, but it's all on the phones now too, so that I guess just having those things handy is fine. And again, a reminder about the car seat, probably the most important thing for you to make sure you have to take the baby home. And then as far as going to the hospital, when you actually go in to deliver, they only want to know 2 things. Quick, who's your doctor, mom? Because that's the most important thing to get the baby delivered safely. And then after a while, they'll get around saying, well, who's going to take care of this baby after he's born? And then they contact the physician. You don't have to, you'll have other priorities at the time of what you're going to be thinking about. But they contact the physician, whether it's 10 in the morning, 10 at night, it doesn't matter. They'll do all of that for you. And typically when they call us through the answering service. If the baby's totally fine, they just leave the message that baby Smith is at this hospital, and then we just show up the next morning to see you and the baby, and come every day you're in the hospital. But you won't have to call anybody or do anything like that. That's taken care of for you. And typically, if the baby's doing great, there's a standard set of routine orders that the baby has applied to her after she's born. They'll take the baby's heart rate, breathing rate, temperature, measure the baby's height, weight, head circumference. They'll do a bunch of things routinely, and those things will happen regardless, unless you and your OB doctor have discussions ahead of time. There are certain things you do and do not want done with your baby. We'll go over a few more in a minute, and I'll explain why it's important to do some of these different tests and things. But those are standard at every hospital, so every hospital pretty much has the same set of standard routine orders to start with. But the pediatrician can be called at any time if your baby has a problem, or if you're having an issue of any kind. You can always tell the nurses, okay, our baby was born 30 minutes ago, but we have a question and we're not getting it answered. by the nurses here at the hospital, we need to talk to somebody, just page our doctor and they'll page us at that time. So, and typically the baby is a patient in the hospital, though a really, really healthy patient, fortunately. But so we're still required to have the baby see a physician or a physician alternative, I guess, every day he's in the hospital. So whether he's there 1 day only or 4 days, every day you're there, the physician will see the baby, examine him, come talk to you, answer questions, go over things like that with you. Right after the baby's born, and this is kind of, I guess in any kind of delivery, whether it's a vaginal delivery or a C-section delivery, the most important things are initially to make sure the baby's nose and mouth are suctioned out so the baby can breathe easily, and to make sure the baby is very warm. So they want to dry the baby off right away and then stimulate the baby. Just the act of vigorously rubbing the baby to dry her off will also stimulate her to start crying, and then they'll try to warm the baby up right away. And some of the best ways to warm the baby is just to put the baby right on mom's chest, because mom will be pretty warm at the time. And unless there's a problem with the delivery, they'll do that, and then throw blankets and covers over so you can snuggle and bond with her. And they'll do what are called APGAR scores. Virginia APGAR was a person who decided there needed to be a more consistent way to assess a baby's status right at birth, to tell somebody right away, this baby is doing great, this baby's mildly in trouble, this baby's seriously in trouble. So she developed a set of scores that they apply to the baby when the baby's 1 minute old, and then also at 5 minutes of age, and occasionally even as far as 10 minutes of age if the baby's really having a lot of problems. And there are 5 different areas that the baby is scored either 0 points or 1 point or 2 points in each of these 5 areas. And the 5 areas are what the baby's heart rate is, or what the baby's breathing rate is, or what the baby's overall color looks like, and what the baby's just natural reaction to irritation. They actually take a little tube and shove it up the baby's nose to see if the baby's nose is open, but they want to see how the baby reacts to that. Hopefully not too happy about it. And lastly, just the baby's spontaneous movement. And so if the baby has a perfect score in those 5 areas, 2 points maximum each, that would be a score of 10. So an APGAR score of 10 means the baby's perfect. And then if the baby, most babies don't have an APGAR score of 10 because most babies, their color isn't too pink right after they're born. They're a little bit kind of a purplish blue, at least around the face and sometimes definitely on the hands and feet. So oftentimes they'll take off 1 point for that. So then the baby would have an APGAR score of only 9 with one of those 10 points taken off for color. The baby is purple or blue throughout and needing some supplemental oxygen for the first few seconds. They'll take 2 points off for color. So the baby's score could be anywhere from 0 to 10. Anything above 7 is considered pretty good though. So if a baby's APGAR score at 1 minute is 7, that's pretty good. And especially if the APGAR score goes up to be more closer to like 8 or 9 or even 10 at the 5 minute, that's really, really good. That baby's having really no major trouble at all. But if the APGAR score is less than 7, we get a little bit concerned, and especially if it doesn't come up at that 5 minute, then we may even check it again at 10 minutes. And if the baby has any problems, we just do some things to help. We stimulate the baby more vigorously. They can have a little tube of oxygen next to the baby and just blow some oxygen and let him breathe a little bit of higher concentration of oxygen to pink up a little bit better. There's things we can do that are very quick and easy, and that's what most babies need, just that little bit of extra stimulation to start doing better. Any questions about those APGAR scores, though, or does that make sense? Okay. People don't need to remember those numbers. A lot of times they'll ask you, what was his APGAR score? But he was fine. That's all you need to remember. There is a state law that babies do need to get an eye ointment right after birth. And it's a state law because there are some really serious infections that babies can pick up in the birth process that involve the eye. Those same infections can actually get down into the baby's lung and cause a serious type of pneumonia in a newborn baby. And this eye ointment protects against both of those things. I know that most of the moms are tested for some of these infections. They do some screening tests of you somewhere along the pregnancy. But still, the state law is we just don't want to miss anybody who maybe the mom had the test done and maybe she didn't quite get it done, something got missed in the process, or maybe the mom's test was done and they kind of mixed up the result and have the wrong result for her and she really has this condition, and the baby, if it's born vaginally, could develop it also. And they say, well, I know we're planning a C-section, but something happened, the baby came early and baby delivered in the middle of the night and the C-section was planned 2 days later, so we forgot about things. So They just give this eye ointment to every baby, not immediately right after birth. They want you to look at your baby, let your baby look at you and smile, and that's the best time. Those first few minutes, the first hour or two after birth, that's absolutely the best time. But then after just a little bit, they'll put the eye drops in, the eye ointment in the baby's eyes, and the baby can still see. It just kind of gunks up the eyes for just a few minutes, but it's really crucially important to prevent these serious infections. So hopefully that won't be a concern for any of you. A bigger concern also is vitamin K injection. Baby's blood does not clot very easily right after birth, and the clotting factors need vitamin K for them to work, and if your baby doesn't have that, your baby could have serious bleeding right after birth in the first, anywhere from the first few minutes, even up to several weeks of age. A serious bleeding in the gut, start having spitting up blood and pooping out blood. More serious is bleeding in the brain, a stroke. And it can happen right after birth, or like I said, days or even weeks later if the baby doesn't have enough vitamin K in his system. Now, breast milk has very low levels of vitamin K, and even though formula has a little bit more, giving vitamin K by mouth a lot of times doesn't raise the vitamin K level fast enough in the baby to help with this blood clotting problem. So we like to give the baby a shot in the thigh of vitamin K, one quick little shot in the thigh, and there's no side effects. The babies do fine. They cry for just a second, but they've been through a lot more with the whole birthing process. But that prevents this bleeding disorder, and it's crucially important. So I hope that if you have questions about that, you'll talk to your doctors about it, whatever, but it's so important and so safe to do. It's actually not a state law. It's just something that we medically think is so important that it's one of the standard orders that is applied to every baby at birth. Unless some parents research it and want to not do that, which we don't really understand because we don't think there's any good evidence that it's dangerous in any way. So it's going to be done unless you specifically say, hey, we don't want this done, and you talk to your doctor and they get some special orders written to not do that vitamin K shot. But we think it's really important. Also, we also think is important, I have to admittedly say not as important though, is hepatitis B vaccine. It is not very likely, fortunately here in this part of the country, that your baby would be exposed to hepatitis B, the virus that's spread through body fluid exchange, like blood or saliva or sexually transmitted fluids, things like that. But there have been cases. There was a baby in Michigan who died recently, I guess it's been a couple of years now, of hepatitis B infection. Hepatitis B in an adult doesn't make you very sick. You don't feel very sick until years later you come down with cirrhosis of the liver or liver cancer. It's really, really serious in adults. But in babies, if they get it, babies can die in a matter of days of a serious liver infection with hepatitis B virus. It's very rare, but it's such a safe thing to do. There's no side effects from that vaccine that we think either, that we recommend babies get the hepatitis B vaccine also. Again, not immediately after birth, but within the first few minutes or hours. Now, they will do a screening test on the mom to see if you are positive for hepatitis B, because for some reason throughout your life you may have picked up the virus. If you're positive, they'll give the baby hepatitis B vaccine immediately, but also give the baby a shot of antibodies against hepatitis B virus. So they'll give the babies 2 shots to really try to decrease the chance that your baby will get this serious viral infection through the birth process. Okay? But this is something that's not a state law, but we strongly recommend that you all consider getting this for your baby. It's so safe, it's so effective, we just think it's really important. And the disease we're preventing is so potentially fatal in the first few days or weeks of life. So, there's a couple other things that weren't on the slide I want to mention. It's also by state law required that all your babies will get a hearing test done. It's a test that doesn't take the baby's cooperation, but it's a screening test. It's not 100% perfect, but it's the best we can do to make sure your baby seems to have normal hearing right at birth. Because babies who are deaf, totally deaf at birth, will babble, they'll talk, they'll act like normal hearing babies until you find out, 4, 6, 9, 12 months later, this baby just isn't responding like he or she should. And by then you've developed some developmental delays that are hard to overcome. If you pick up hearing loss in babies shortly after birth, you can sometimes do hearing aids and amplify their hearing, and you don't have any of those developmental delays. So now it's state law in most states to have babies get their hearing screened right after birth. They actually make some clicking noises, and they just monitor by some little electrodes on the back of the scalp how the baby responds. Those sounds can be transmitted back to that part of the brain. Not perfect, but it's a pretty good test. and it'll help us right away see if your baby has a problem with that. I'll just tell you that many babies fail that test and pass the follow-up test. So don't be concerned if your baby, especially if your baby passes one year and fails the other. Almost always that baby is going to pass the second year like a week or two later when they do the follow-up test, okay? It's not crucial you find out in the first few days after birth, but in the first few weeks after birth. But it's when babies fail both hearing tests we get more concerned, because that's what we're trying to screen for those families. I have several families who every child in the family is deaf, and it was something they inherited from the family. So we kind of thought that would be the case, but that's what we're really looking for, is the babies who have this deafness in both ears. But still, it's important to do both to make sure. It's possible baby could have decreased hearing in one and normal hearing in the other. Also, a state law is that babies will have a blood test drawn after 24 hours of age. And this is something that screens for like 35 different diseases. For instance, sickle cell disease, cystic fibrosis, low thyroid, a bunch of different conditions that can take a perfectly normal baby, and if we don't pick up, for instance, low thyroid and treat the baby with thyroid, by several months of age the baby's permanently retarded and nothing you can do about it after that. But if you pick up that the baby has low thyroid right in those first few days or weeks of life, treat him, perfectly normal baby the rest of his life. So these are crucial conditions, and they have to wait till the baby is at least 24 hours of age. If it's done sooner, it has to be repeated because the test is not valid if you do it under 24 hours of age. They'll poke the baby's heel and collect 4 to 5 drops of blood on a little piece of filter paper. It's run through a machine that can rapidly test for all these different conditions. And that is a state law that babies get that done no matter where you're born. And unless, again, you and your OB doctor try to sign some waivers and things like that. Again, we think that that it would be better to do the test, definitely safer for your baby to do that. Those results take a while to get back, though. They take like 10 days or more to get back. So you'll leave the hospital before you'll know those results. But that'll be one of the things that your doctor will follow with you in the office at one of the first checkups. And another thing they've started doing that's kind of recent is there are types of heart disease that a baby can have and may look totally normal. The color looks good, and the baby, when the doctors listen to the heart, don't hear any heart murmurs. But what can happen is after several days of life, some changes occur in a baby's heart that can cause a serious life-threatening problem where the baby can't circulate blood with oxygen in it, and babies can suddenly collapse and even have a fatal episode. And there's a really easy screening test where they just put a little clip on the baby's finger and measure the oxygen, and they'll do it usually in the right hand, the right arm, and then usually they'll do it in one of the legs, at least one arm. The right arm always only, not the left for some reasons I won't go into, but the right arm and then either of the two legs, and they compare, and the oxygen level should be about the same in each one. If there's a little difference, it's okay, but if it's more than a small difference, then it suggests that baby could have one of these problems that's called critical congenital heart disease, and then it just means we need to do a test, an ultrasound of the baby's heart, called an echocardiogram, which maybe you've had ultrasounds of your baby. It's the same process, very easy, no radiation, very safe, to see if there really is truly this heart problem. But that's something that just went into place just recently, this little test called oximetry, where they measure the oxygen. It's just like, it looks like a little clothespin with the wire on. They just clip it to the baby's hand and the baby's foot and measure the oxygen level. Question about any of that? Or okay. And then as far as now what, once you actually do get home, well, they talk about keeping track of the baby's feedings, which is kind of important, as well as a little bit of how often the baby is stooling and how often the baby is voiding. We do like to see babies urinate in the hospital, hopefully within the first 24 hours or not much longer than that, because that's a bit of a concern. And we like to see them poop within the first 48 hours, 2 days if possible. And again, a lot of times there's no problem if the baby doesn't quite meet those deadlines, but we get a little concerned about a few different kinds of conditions that can cause a problem if the baby doesn't do it by then. But we'll be keeping track of that. You won't have to keep track of that. And once you go home, although some people focus more than others on keeping track of the baby's peeing and pooping, that's pretty easy to do for the first few days or first week or two. And after that, if things are going great, we'll say, hey, this is not a patient anymore. This is just a baby. Just go home and enjoy. Don't keep track of all that information anymore. But especially with breastfeeding babies, you never really know just how much they're getting when they breastfeed. So sometimes those babies we try to keep track of a little more closely about how many poops and pees they have once they get home. Bottom-fed babies, not so much, because you can say there are 2 or 3 ounces gone every time, every 3 hours. You pretty much know what's going on with bottle feeding. I guess the thing, if I would tell you 2 things, this would be the second one. That is, remember to rest. That's probably the biggest problem we see with babies having trouble with moms at home. Dads too, I guess, but just you try to show off for everybody. Look at grandma and aunts and uncles and neighbors and friends, and everybody wants to come over, and it's great, but it's exhausting. It's kind of exhausting for the baby a little bit, but really exhausting for the moms especially. So you just have to live for your baby. Just that first week you're home at least, or that first weekend, just try to forget everybody else and don't change the bathroom wallpaper and things like that. Just take care of yourself. Feed him and sleep. Feed her and sleep. Feed him and sleep. Feed her and sleep. That's all you really need to do, and just get as much rest as you can. That's just crucially important. Everybody has good intention, but they come over and they want to see the baby, and when the baby finally falls asleep, well, then they want to talk to you, and just you're exhausted. Now, if you're bottle feeding, it's so much easier because anybody can take the bottle and feed the baby while you go chit-chat, and you go nap later, and somebody else feeds the baby when she's up crying. But breastfeeding is exhausting, so please just plan to keep people away. And this is Dad's big job, I guess, is try to get Mom to get more sleep. Try to get people just to give you a couple days, to kind of get home and get rested and try to get breastfeeding to be more successful. What's the first thing I would say? In the hospital, try to get help as much as you can with, if you're going to breastfeed, every time with getting the baby to latch on to the breast. That should be so natural, right? You're a mom, it's a baby, it should all be beautiful. It is, but not at first. It's very frustrating, it's very difficult, and if you get lots of help and lots of practice, it goes great. And if you don't get lots of help and practice, it can be really difficult. And it's that way for everybody. Don't think it's just you. It's that way for everybody when they go home, especially the first baby when you don't really kind of know exactly what's going to happen. It's very frustrating at first. But if you get lots of help, lots of support, and lots of sleep in the meantime, things can go much better. So get the baby to latch on in the hospital, get home, and sleep more. Those are the 2. If you don't remember anything else today, just remember those 2 things, and that alone, I think things will go better. If you're bottle feeding, it's easy. But don't let that discourage breastfeeding. I hope I didn't do that. Didn't mean to. So again, the choice of breast milk or formula. Well, we do recommend, everybody in the American Academy of Pediatrics, the AAP, does recommend breast milk for the first year of life, and because it does better. Babies get better nutrition, they get antibodies to help fight infection, they have fewer problems with allergies as they get older. There's every single benefit. There's really, moms lose pregnancy weight quicker. It helps mom. It helps the baby and the mom both. Breastfeeding is really the best thing you can possibly do. But it isn't for everybody, so we want people to know that. We're supportive of you, whatever works for your family situation. Yours may not be a situation where breastfeeding is perfect for you. And you can do exclusively breastfeeding. You can do exclusively breast milk in the bottle. You can do some breast milk and some formula, both in the bottle. You can do just formula in the bottle. You can do any combination you want. We still think breastfeeding is best, or breast milk in the bottle is best, but anything you can do. And if 1 month is good, well, 2 months is better. But if you say, I can only do 2 months, so I'm not going to do it at all, well, we think 2 months is better than 0 months. So anything you can do to get your baby, you just want to give breast milk in the hospital and change right when you get home, that's fine too. Any amount of breast milk is only good for your baby and for you. So try to keep that in mind. But we're supportive of whichever you would choose. Just remember that babies need to eat frequently, not necessarily very much. A baby's tummy is the fastest growing organ in its body. It increases 6 times in 1 month. So babies are 20 inches long at birth. If they got 6 times taller in 1 month, that'd be 10 feet tall in 1 month. Shows you how small the stomach is, how fast it grows. So babies only take like maybe ½ an ounce at most the first day or 2 of life, and they're up to 3 or 4 ounces by the time they're a month old. So it's better to have small amounts frequently than expect your baby to eat a lot. If baby eats a lot, just throws it up, and then gets everybody upset. So better small amounts more frequently is better. But feeding more often is what babies need, because they don't have all the fat stores that some of us adults have, and they can't keep their blood sugar up as easily as we can. So they have to eat more often, smaller, more frequent feedings. So, and typically the comment they use is dazed and confused. Most babies, right when they're born, they are wide awake with all that adrenaline flowing through them. Mom will be wide awake with all that adrenaline flowing through her. Dad who knows? We're pretty tired usually, and we don't have the adrenaline quite. But the biggest thing is that's the time when your baby's the most wide awake, going to nurse the best. Mom is going to be wide awake. It's going to be great. And then pretty much after those first few hours, that baby's just going to crash and try to sleep for about a day and a half. Moms won't be able to. All that adrenaline just prevents you from sleeping. Dads will be asleep just fine. So the main thing is try to nurse very often right after birth and try to get help feeding the baby very often. But remember, those first day, day and a half with breastfeeding, it's more about the baby stimulating you to start producing milk. Not that the baby's going to get a lot of milk, but it's to produce you to produce breast milk. In fact, most moms make less than 2 ounces of milk a day the first day after the baby's born. But that's all the baby needs. And then she'll be up to about, 6 to 7 ounces by the second day, and then that doubles again by the third day. So it rapidly goes up. And the baby was like a little sponge there inside you these last few weeks and months and soaking up all that fluid. Right after she's born, she doesn't need to eat that much. She'll like to nurse, but she can kind of coast for that first day or 2 or 3. But once she gets what we call her dry weight, she'll lose weight anywhere up to half a pound to a pound, depending on how big she starts out. That's when things change. That's when you see the real personality of your baby. She's going to get really hungry, really demanding. Yeah, it's about midnight the first night you're home. So just get as much rest in the hospital as you can and nurse often. Remember, it's more about her learning and him learning how to eat, not so much that you're giving him a lot of milk. He's stimulating you and he's learning how to latch on, and you're learning how to make that happen for him. And so the signs of hunger, the rooting around, the restlessness, you'll get all that in abundance in the hospital before you go. Breast milk is great. It is cheaper. It's natural. The colostrum that babies get those first few days, it's really different than normal breast milk. It's high in protein and pretty low in fat and low in carbohydrate. And so what you're going to see is it's more of a kind of almost a bright yellow color, and then more mature, and it's really thin and watery. And more mature breast milk after several days or a week becomes more thick and white and creamy and sweeter also. But that colostrum is loaded with antibodies to help the baby fight infection. It's just best for the baby. And we haven't been able to reproduce anything like that in doctors trying to produce formulas and stuff to give the babies who, for whatever reason, aren't going to get breast milk. We just don't have a way to be as smart as that to create that kind of stuff. But it does provide, like I said, some of the antibodies to fight infection, and particularly the bonding that occurs. Like I said, even if your baby's not getting a lot to nurse, just snuggling with your baby, that's just the best thing you can do. Your baby bonds with you, bonds with dad's looking at you. Baby's vision, they're really nearsighted. They can see about a foot and a half away. So your face to their face, that's their best vision right there for the first several weeks or months of life. So the more you can just be with your baby, snuggling, just think of it as snuggling more than feeding. It's really stimulating you to produce hormones from your pituitary gland that will go to the breast and produce breast milk and help it let down to the baby. But don't expect the baby to nurse great and be content and burp easy for you. That just doesn't happen those first few days. So think of it more as snuggling and letting the baby stimulate you at first. The lactation consultants, I just can't emphasize enough, please get them involved early and often with helping with breastfeeding. You think it should be natural. It's like the most unnatural thing you can think of until it's going well. Then it's like, oh, it is natural. It's great, but it's really rough at first. And dads, we have such good intention, but it's so difficult for us to do anything. I mean, all we can do is everything else. Let mom breastfeed and we do everything else. That's the best we can do, and keep people away in the first week. Measuring how much the baby gets, that's probably not that important. The best indication really is the baby's contentment and peeing and pooping, and you can do things like weigh the baby before and after nursing, but we don't really recommend that. The baby's behavior tells you almost everything you need to know. If the baby's happy and wakes up and eats and goes back to sleep and then gets up on its own to eat again, things are probably going okay. But there's a lot of questions about how will you know if breastfeeding is successful? You just talk with your doctor, and we arrange to do follow-up phone calls after you leave the hospital, and sometimes see the baby just at a day or two after they leave the hospital, just to make sure things are going the way you want them to be going, to be successful. It just depends. It's different for every situation, and so just close follow-up with your doctor is the main thing. Some of the formulas, the newer formulas, have things added to try to mimic what's in breast milk. Is it important that you go out and buy the most expensive, fancy formula? Not necessarily, again. We just say talk to your physician about that. There are pros and cons of all those things, but talk to your physician. Dads can help. We try. I mean, we do what we can. it's never really as much as we want to do, because you just so want to be helpful, especially with breastfeeding. Bottle feeding, we can help tremendously, and we can take care of the bottom end if mom's taking care of the top end. We can do that diaper thing. So as far as specific types of formula, it just depends. Some babies have special needs for special situations, so we just have you just check with your doctor about that. Breast milk, feeding on demand is always good, but we don't want, sometimes the babies will be really sleepy. They might sleep 4 or 5 hours, which is not so good for the baby. We prefer that the baby eats a little more often. Plus, you're going to try to get the baby's days and nights straightened out so the baby kind of sleeps at night if you're lucky, and is up more during the day eating. That just takes time. That can take weeks, months for that to happen, though. So just not going too long at a time. Just the first few days until you know you're making milk and the baby's getting enough milk. So that first week or so, waking up at least every maybe 3 hours, never longer than 3.5 hours, is helpful, just to make sure the baby's doing okay. Formula feeding, again, it's so easy. The baby slams down 2 or 3 ounces, sleeps like a champ. Well, that's pretty tempting, I know. But like I said, there's advantages to both. So cluster feeding, many babies will do that. They'll be kind of content, but they seem to sense at the end of the day, okay, I need to eat a lot more because I'm going to try to get a longer period of sleep. So that's something, and that goes in cycles too. The baby will be fine for a couple weeks, then have a growth spurt and go crazy, and then be fine for a couple weeks, then have a growth spurt. And so just have to kind of roll with it. I mean, there's a lot of on-the-job training, especially breastfeeding at first. So, and again, as far as the bottle types, we mentioned there are certain nipples that the milk, whether it's breast milk or formula, flows quicker or more slowly. That really just depends on what your baby's eating style is like, and it's just trial and error there. Again, as far as looking for the BPA-free products to cut down the risk of baby's exposure to that product. I mentioned earlier from the hospital, the hearing screen that's done on all babies, that newborn metabolic screen, that blood test. Circumcision is, over the years, has changed a little bit. Years ago, they used to say there was no overwhelming medical reason to recommend to do a circumcision. So it's strictly up to the parents, religious reasons, cultural reasons, social reasons, whatever it might be. But recently they know that there's a greater risk of preventing infections in boys, and not just a typical bacterial infection like a bladder infection, a urinary tract infection, but also it cuts down on sexually transmitted infections, and we're talking, we hope, decades down the road from the boy. So now the recommendation is a little more strongly to do circumcision, but still it's not required, it's certainly not, but it's a little more, yes, maybe it's a good idea to prevent some of these types of infections. We should talk about it. I mentioned the weight loss earlier. Up to 10% of a birth weight is considered okay. Much beyond 10%, and especially the breastfed baby, we're worried that the baby's not getting enough breast milk then. And again, that's something that we do based on calling you and seeing the baby in the office at a few weeks or a few days after dismissal sometimes. Monitoring for jaundice. All babies tend to get a little yellow. It usually starts in the face and kind of yellow face, then chest, then tummy, and then it goes away in the opposite direction a few days later. And that's typical in all newborns in the first 3, 4, 5 days after birth. But breastfed babies, again, have a bigger problem with this. And if the jaundice, this yellow skin color, due to a dye in the bloodstream called bilirubin, if the bilirubin level goes too high, it can actually cause some problems with the baby. So we have a way to check it. Most hospitals now do a test for this. They push a device on the baby's forehead, and it actually can measure somewhat the level of bilirubin in the skin causing this yellow color. If they think it's too high, they'll do a blood test, which gives you the absolute number of this bilirubin. And so that's something that they'll do. I think almost all the hospitals are doing this routinely now. The day the baby goes home, whether the baby's 1 day or 2 days or 3 days, they may do that test before the baby leaves the hospital. And then to talk about circumcision again, it can be done by the delivering doctor, or by the pediatrician. Either one is fine. Caring for that is pretty easy. Just use some Vaseline and just wash with normal soap and water. They heal very quickly. They just seem to never get infected. Jaundice, as I mentioned, is due to that bilirubin, that product that causes the yellow skin color. And the skin test, the transcutaneous, where they press the light on the skin, the blood test is more accurate. And we would talk about that several days after the baby goes home from the hospital if there's a need for that. One of the questions, years ago, we used to have babies go home after delivering the next day. 1 day, that was it. C-section, you got to stay 1 extra day, that was it. And babies had lots of complications, and so did moms. So now it's back to the way it was, well, 25 years ago, where after a vaginal delivery, usually you can stay 2 days and maybe even 3. And after a C-section, you usually can stay 3 and most of the time even 4. And I would encourage you, if you're breastfeeding, to stay that extra day. If it's covered by your insurance, it's not something you're paying out of pocket or something, just because you get more help with the lactation consultants and the nurses with breastfeeding assistance. So that's probably the biggest thing, is just to get lots of help if you're in the hospital with breastfeeding. Again, bottle-fed babies, it's really not as big an issue for the baby because the babies do fine. When you're home, number one, sleep when the baby sleeps. That's mostly mom, but if it's bottle-fed, it could be either of you. But if you're breastfeeding, you have to just sleep when the baby sleeps. Otherwise, you're just exhausted, and it's just a recipe for having not success with breastfeeding. Forget about everything else, the laundry, things. Forget about the messy house. I'll let people come and help, but they're here to help you, not here to keep you up and talk when the baby's asleep. So you need to drink normal amounts of fluids, not extra fluids, just normal amount to help recover from the delivery and get good nourishment. And usually they want you to take prenatal vitamins still after delivery if you're breastfeeding. Now I guess they're making postnatal vitamins too, but you can ask your OB doctor about that. And usually, like I said, the first office visit may be just a day or two after discharge to check the baby's weight and color and see if there's any feeding issues. Sometimes they'll wait till 2 weeks. Just depends how the baby's doing. And our target, since all babies lose about ½ a pound to a pound after birth, our target is to get the baby back up to birth weight by about 2 weeks, 3 weeks for sure. And then review some of those blood tests that were drawn but don't come back for about the first 10 days or so. And all the other routine vaccines don't start till at the next visit at 6 or 8 weeks, 2 months of age. So there'll be another vaccines at that visit. Unless you chose not to get the hepatitis B vaccine in the hospital, some people will choose to get it at that 1 or 2 day visit or 2 week visit in the doctor's office, either way. I mentioned peeing and pooping. I would just say one thing. The initial poops that babies have, stools, are very black, sticky, tarry, called meconium. It's not what your baby's eating. It's what's been built up inside the baby's intestines for the prior 9 months. And it takes a day or two for that to kind of clear out of the system. One way you'll know that the baby's getting enough to eat is if the stools are changing from that black, tarry, sticky to more of a wet, slushy, almost like applesauce, wet and slushy, but it'll be bright green or even a yellowish green color with little sesame seeds in it. So that would be a perfectly normal stool after a few days of age. But if there's baby still having that sticky, black, tarry stool, meconium, after a few days of age, that might suggest the baby isn't getting enough to eat, especially breast milk, obviously. So, and when they say stools are all over for breastfed babies, that means all over the place for timing. The joke is you can have 10 stools in 1 day, only 1 stool every 10 days, and that's still the normal range for breastfed or formula-fed babies. So it's really more about how the baby's acting and how the baby's gaining. There's just a bunch of things. The baby's behavior is really the single biggest thing that we talk about, but it's the hardest thing to talk about because you can't say 3 poops or a temperature of 98. I mean, you'd have to just talk about it. So that's the best prediction if your baby's doing fine. And constipation to us means hard poop that hurts to pass out. It doesn't mean infrequent poop. So literally, if we have babies going once a week, but they're fine, they're fine. Yes, but they're having passing little rock hard poops and they're screaming to pass them, that's not fine. We have to fix that. So bathing, it's really up to you. You can really bathe babies every day if you like it, if he likes it or she likes it, or much less frequently. They don't get too dirty except their bottom sides usually. So, and water temperature should be warm but not too hot. There are babies who get scalded. So we think your hot water heater should never be set higher than 120 degrees. It's too easy to accidentally get really hot water and scald a baby if you do. So no hotter than 120 if possible. We recommend sponge bathing, wiping around the cord, not the cord itself with water till it falls off. The drier you keep the umbilical cord, the quicker it falls off. And as it starts falling off, it'll start oozing and draining sometime. Only if it has that can you take like a rubbing alcohol and clean any oozing and draining. The cord stays clean and dry. Just leave it alone and just sponge around it. Once it falls off, then you can submerge the baby and wash over everything. And the whole cord area should be totally dry by about a month of age. If it's not, there are a few other medical conditions you want to talk to your doctor about. As far as trimming nails, this is an interesting thing. The hospital used to trim your baby's nails for you. They won't anymore because of legal reasons. So you'll do it yourself in the hospital or at home. And I'd suggest you don't trim them, clip them. Rather, I'd suggest you file them at first because the fingernails are so soft, they're like butter. And a file will just easily just smooth them off and shorten them up. If you clip them, we have so many babies wearing Band-Aids on their fingertips because the parents are trying and they're just trying and they clip and then everybody's crying because there's babies crying, the mom's crying, dad's crying. So just file them at first. It's so easy. And once you get home and get comfortable, you can always clip them later. You can keep the baby's hands covered. They make long sleeve baby shirts with like little mitts that kind of fold over to keep the baby so he won't scratch his face or she won't scratch herself. So, few concerning signs and symptoms. Fever in a newborn is always a big concern, and we think you should never take your baby's temperature at home. This is just a baby. This is not a patient anymore once you go home. But if your baby is acting sick, then you should take the temperature. And we think the rectal temperature is the most accurate. The hospitals also used to give thermometers for parents to take home, but they don't anymore because that's another expense. So make sure you have any kind of little thermometer that you can use. Just need a thermometer, a little Vaseline, put it on the tip of the thermometer, just insert it in the baby's bottom, and you'll get the temp very quickly and easily. Anything above 100 and a half, 100.4, 100.5 and higher, that's true fever, and that's always a major emergency in a newborn baby in the first month or two of life. So just remember, only take it when the baby's sick, and always call immediately if it's ever above 100 and a half. That's crucial. Sometimes other signs and symptoms, babies are either extreme, very irritable, or won't wake up at all. Obviously, any extreme there. Babies get increasingly yellow or start throwing up everything, or just make sure the best way to keep your baby healthy is keep your baby away from other people who are not healthy. Babies don't get sick. You could go tomorrow, deliver tonight, go for a stroll tomorrow down the street, fine. But if you go home and then all the aunts and uncles are there to want to pass the baby around, that's where your baby will get sick. So always blame the doctor for this one. This is easy. Blame us all the time. Carry the bottle of hand sanitizer. Sorry, Mom, you can't hold her till you wash your hands off here. That's easy. And also, sorry, Mom, don't come over this weekend. Doctor says you can't come over for 2 weeks or so. Blame the doctor for everything. That's the easiest. That's the best advice I can give you about that, because especially if you have other like little nieces, nephews, cousins, they just can't keep themselves clean. That's okay. But if your baby gets sick in that first month or two and has a fever, your baby will be admitted to the hospital, have to have IV antibiotics, have to maybe get a spinal tap done, all these really invasive things to ensure that the baby just has a virus and doesn't have a serious bacterial infection, which could be fatal in a matter of hours in a newborn baby. So just have to be so careful about that. As far as babies that are fussy, remember that crying is normal for babies. So your doctors will hopefully go over with you the fact that a little crying can be normal. And you just check the basic things. Is the baby cold? Is the baby wet? Does the baby have a poopy diaper? Is the baby hungry? There's some things to look at. There's a few other conditions that can cause babies to be fussy, but those are something you can talk with your doctor about, like colic and things like that. MSPI stands for milk soy protein intolerance, which my 3 kids had, or they have like an allergic reaction to protein and what they eat. And you just have to pick a different formula, or if they're breastfed, you just have to have mom limit certain things in her diet, and the babies can do much better sometimes. The 5 S's they talk about to help quiet a fussy baby. Swaddling, which has kind of gotten a little bit of a bad reputation recently too, because they think too much swaddling may increase the baby's risk of dying of SIDS. So it's something that you'll talk to your doctor about, how much swaddling should really be done or not. Placing the baby slightly on the side. Shushing, meaning again having sound. If the baby can listen to sound, that can help distract the baby, make them be more content. Swinging, a swing's kind of handy. That's that stimulation, that physical stimulation, like a vibrating chair. Just a swing can help babies be more content. And sucking, happiest baby on the block. 2 of my 3 kids do this. Pacifier. It's kind of controversial, but I think it's an easy thing. It's a lot easier to get rid of a pacifier habit than a thumb sucking habit. So if you have a baby who's content and doesn't need to suck, well, that's great, then don't worry about it. But if you have a baby who's very fussy and needs to suck all the time, I actually encourage the pacifier use, although it's, again, optional. There have been some research evidence that shows that babies with the pacifier have less chance of sudden infant death syndrome, also some things like that. And the passy is easy. You just get rid of it down the road, and it's so easy. A thumb sucking habit, we have 10-year-olds in our practice still suck their thumbs. It's a very difficult habit to break. A pacifier is very easy to break. But you don't want to do it at first, because if you do the pacifier, the baby says, well, I like that. I don't want to breastfeed now. So the formula doesn't matter, the bottle doesn't matter, but the breastfeeding can be. So we don't say start the pacifier at first, but that's something you can talk to your doctor about after a few weeks or a month of age or so. The last thing here, it says you cannot spoil a baby in the first 3 months. I think that's true. You can snuggle that baby. Every time that baby cries, you can jump right away and pick her up, pick him up, rock him, sing to him. You won't spoil him. But after a few months, if you keep doing that, You will spoil them. So don't anybody tell you you can spoil that baby that first month or 2 or 3. You really cannot. The baby needs to develop a feeling of security and trust in its environment, which they'll do so if the adults respond pretty quickly. So you can't spoil them at first, but you can only later. Babies spit up a little bit, and if the babies are spitting up and they're not being fed too much at a time, your doctor can tell you how much is a reasonable amount at a time. But if the baby's spitting up but happy and gaining weight, then just put up with it till they outgrow it. If they have other issues like they're spitting up green stuff like bile, or they're not gaining weight, or they're extremely fussy, there's some things we can talk about doing to help that. This milk soy protein intolerance, it's something that's not that common in certain nationalities. It's more common, but it's just that babies sometimes get fussy or spit up or have diarrhea or constipation or bloody or mucousy stool, and you just have to either change formulas or change mom's diet to maybe make a difference. And they usually outgrow it. It says by 1 year of age. Many babies outgrow it by a few months of age if you make the changes quickly enough when you start seeing that problem. My 3 kids who had it, they have milk and everything. By the time they're a year, they had no problems at all. So it's a baby thing. It's not lactose intolerance. It's not a milk allergy. It's a protein intolerance that babies outgrow very quickly. Important is back to sleep now. Years ago, we had babies sleep on their tummies, and we found they died of SIDS. We put babies on their back. Their chance of dying of SIDS went dramatically down, 10 times less SIDS now that we have babies sleep on their backs. But the problem is babies get flat heads now, because when they sleep on their backs, if they have their head the same direction, the bones of the skull are soft, and literally the head will flatten out. So you have to kind of rotate the head, and that's something that your doctor will talk to you about. But just remember, back to sleep is so much safer. And people say, won't the baby spit up and choke? That doesn't happen. You think it would, it doesn't. So back to sleep is the safest. So again, back to sleep tries to cut down the risk of SIDS. Also having the baby not be around cigarette smoke. Cigarette smoke increases the risk of SIDS. Breastfeeding helps diminish the risk of SIDS also. Firm mattress, again, cuts down the risk of SIDS. Pacifiers can help. Babies do have some funny movements at any time. And by the way, if anybody has to leave and you think you have a question you want to ask before you leave, you can feel free to interrupt me anytime, but we'll finish up here pretty quickly. Babies do have some normal movements that would be abnormal in an older child. A lot of times they'll jerk or startle. We do it when we fall asleep. Your leg may twitch a little bit, but the baby's whole body will twitch for even a few seconds, and that can be normal. Baby's eyes will cross all the time. They shouldn't do that after a year of age, but up to a year of age, if they cross for a few seconds, then they gradually straighten out. That's normal. That's fine. But the baby has trouble not moving one side or very stiff or floppy all the time. That's a big concern. But hiccups and sneezing, those are normal things. Mattery eyes, babies, when they put those antibiotic eye drops in right at birth, can get a little mattery to their eye. There is another condition where their eyes are kind of mattery for several months of age from a plugged tear duct, but your doctor can tell you how to kind of massage the eye, wipe that away, and hopefully most babies, 9 times out of 10, that'll just go away on its own. If it doesn't, there's an eye doctor who can pop a little probe in the tear duct and it opens up right away. So, babies have a funny breathing pattern. They're very noisy because they're nasal breathers mainly. Babies don't breathe through their mouths initially, so they're constantly they're nasally congested. They'll fight to breathe through a stuffy nose. They'll sound really different. They also have a pattern called periodic breathing, where they'll take some slow breaths, then they'll go really fast, then they'll have slow breaths again, then they'll go really fast. And we do that in deep sleep. The babies do it all the time, and it gets very concerning, but it's a normal pattern in babies that they just outgrow. A few rash things. Babies can be born with baby acne or milia, especially on the nose, the little kind of white bumps on the nose. All that just goes away on its own. Erythema toxicum is a rash that more than half of all babies will get after 2 or 3 days of age. Little red blotches all over, little bumps in the middle. We used to call them flea bites because that's what they thought. They're not flea bites. And they just disappear. They don't itch. They don't bother the baby at all. They just bother the photographers and the family. And cradle cap's a common thing. Your doctor can tell you how to take care of that. It's nothing you did wrong. It's just the baby has dry skin and the scalp overreacts to dryness. It's not that you're washing the baby wrong or anything like that. It's just a normal baby thing. Same with diaper rashes. If your baby gets just any kind of irritating diaper rash, your doctor can tell you about yeast medicines to give and things like that. Lastly, you'll get lots of advice from family or friends, and it's right for some baby. And it might be right for your baby, but it might not be. So just remember, whatever they tell you, especially grandma, never argue. Just nod and say, yes, we're going to do that. And then when you get home, do whatever you think. But don't ever argue, because that just doesn't work. But also check with your doctor. And the Academy of Pediatrics, I'll just put in a plug, they have a paperback book. It's hardcover too, but the paperback's a lot cheaper. It's about this big and pretty thick now. It's called Your Baby's First Year. That book is excellent. It has everything you need to know, like thousands of times more than what I told you here tonight about your baby. So Your Baby's First Year from the American Academy of Pediatrics, that's an excellent, excellent book. And some hospitals used to give it out when babies are born, but guess what? Yeah, they don't anymore. Like the thermometers, it's a cost thing. And I guess, well, they say don't shake a baby. That's obviously kind of really important. I don't think there's any more things I have to say unless any of you have questions for me right now, or any questions on the offsite. Yes, ma'am?
What if you're delivering at like an Allegiant hospital? Can a children's physician still come in there to see the baby?
Right. We see all the children's physicians, all the physicians from all organizations go to pretty much all the different hospitals for different things. Allegiant, I'll just say yes. I mean, children's didn't used to deliver babies. They took care of sick babies. But so we have to go to wherever the babies go. Wherever the babies go, that's where we go. Yeah, so we go to any of those hospitals. But so do all the other physicians, unless they're in a system that prevents them from doing it. But children's goes to all of them. Other questions? Yes, ma'am?
What's a good way to pick out a pediatrician? Like what's
Well, I think the three best are ask your OB doctor. And because sometimes your OB doctor will say, well, yeah, I've heard some things about this group, but I've heard only good things about this group. Well, that's very helpful, and you trust your OB doctor. Ask your friends, anybody you know who has kids, say, well, where do you take your kiddo? How does it go? Do they answer your questions? Do they get you in on time? Are you waiting too long for an appointment? What's the office like? Is it clean? Is it rushed? Or, just ask people who go there. And I think a good thing is just to go for a prenatal interview. I mean, if you say, okay, talking to friends, talking to coworkers, talking to my OB, I have like 3 different people. They're in 3 different offices. Well, I'm just going to call and say, can I have a prenatal visit? There's no charge for those. You just show, and like I said, they'll do them sometimes morning, sometimes over lunch, but usually in the evening, like at 5 or 5:30 or whatever. And you just show up and you just sit down, you just look at the office, you talk to the person, get your questions answered. Say, I don't think my philosophy on doing vaccines is this. That doctor has a totally different philosophy, not for me. Or, yeah, we have the same philosophy, but he rushed me. He rushed me through the visit. I didn't feel I could get my questions answered. So I think you just have to kind of take a leap of faith and talk to people and say, okay, I trust that person, maybe I'll do that. I mean, pretty much all the physicians in Omaha, we're really lucky. You guys maybe know this. We shouldn't have what we have in Omaha. I'm from Omaha, so I can say this. I'm a South Omaha boy. We have 2 medical schools here, Creighton and Nebraska. A state this big should have none. We shouldn't. We have a $100 million children's hospital. We shouldn't have that either. We have so much healthcare in Omaha that's really, really good that it's surprising. You think, well, we're just a little Omaha. We're really not. Some of the specialists here are amazing. So you have lots of good doctors to pick from. So I think whoever you see, you're probably going to get a good doctor. You're going to have people who are board certified, we've taken and passed all the tests, that kind of stuff. I just think it's just more of a personal fit. So I think you just have to kind of interview people and talk to friends. And if you start with somebody and say, this isn't working too good, but I really liked his young partner over there, we'll switch. I mean, what's more important than this baby? Nothing's more important than this baby. We know that. We're in that place with our own kids. So it takes some time, but it's not too hard. I would say a bigger thing is picking your child's, if you're going to be like back to work and stuff, picking your child's daycare. To me, that's much more difficult because that's hard. That's hard to do, to find something that's convenient and cost effective and really good and not too many kids. And that's to me would take a lot more effort and time. I don't have a quick answer or a quick lecture on that or anything like that. But finding good child care is crucially important if you're not going to be able to stay home with your baby or have a trusted family member or something like that. That takes a lot of effort. And I encourage you to go start looking early and often and contact the state health department and family and friends and go interview those places. That's probably more important even than the physician. But yes, ma'am.
Are you a practicing pediatrician at this hospital?
Right. I mean, well, yes and no. I'm one of children's physicians, which means I've been a pediatrician like these last 20 years. My office is on 138th and Maple Street. in that Eagle Run office they said at the start here. Although I do come to this hospital, but we fortunately, knock on wood, we don't have many sick kids. And so I'm just mostly an office doctor. I mean, like I have a really critically ill patient right now who's here in the ICU being taken care of by all the specialists. We're so lucky to have these specialists here because she's doing great, and we're just lucky. So I do have patients who come here, but generally, like to answer the delivery, we pretty much go to all the hospitals. We go to the Methodist system, the Allegiant system. We go to all the different systems. And if the kids are really sick, which we hope is never the case, we're lucky that those systems aren't designed to take care of little sick kids or even big sick kids, like with major injuries, illnesses, cancers, whatever. So they pretty much come here to Children's for that. Or sometimes the medical center. Sometimes even Children's doesn't have certain things that they have to go to, like Nebraska Med Center or something. But we know all these specialists. They know us. It's a small town, really, almost kind of a small town, and the community doctors pretty much knows everybody else, which is nice. Straley, Straley, Joe Straley. Any other questions? No? Well, I hope the food was good, and I hope it was worth your time. Good luck to everybody. Congratulations.